Alright, so today we'll be going over the pre-exercise screening tool, which will ask you a series of questions to determine your health factors of both past and present, anything from a sore ankle to something serious as cardiac arrest or disease that may be in your family. Okay, and that's just to eliminate any exercise risks happening, anything from happening so I can put you into a program with a good exercises and intensity that suits you. Are you happy to go ahead with that?
Sure.
So, okay, we'll start in stage 1. To identify those individuals with known disease or signs or symptoms of diseases who may be at higher risk of an adverse event during exercise, activity or exercise. This stage is to be self-administered, but because I'm here with you today, I'll do it with you. Has your doctor ever told you that you have a heart condition or have suffered a stroke?
No.
No? Wonderful. Have you ever experienced unexplained pains in your chest or arrest or physical activity or exercise?
No.
No. And have you ever felt faint or dizzy during exercise or lost balance? Wonderful. Have you ever had an asthma attack requiring immediate medical attention at any time over the last 12 months? If you have diabetes type 1 or 2, have you ever had trouble controlling your blood glucose in the last 3 months? Do you have any diagnosed muscle, bone or joint problems that you have been told could be affected by participating in physical activity? Wonderful. Do you have any other medical conditions that may make it dangerous for you to participate in exercise? No? That's great, because you've answered no to all 7 questions. There is no concerns about your health at the moment, and you're okay to proceed to undertake light to moderate intensity of physical activity and exercise. So I'll just get you to sign and date just down the bottom here for me. Wonderful. Okay, so what is your age?
37.
37. And gender, you are a female. And because you're a female and you're under the age of 55, there's no risk factors for you to participate in exercise with that. And do you have any family history of heart disease, stroke or heart attack? No. Not for us. Do you smoke cigarettes on a daily or weekly basis? Or have you been quitting the last 6 months? No. Great. Describe your current physical activity exercise levels. So sedentary, light, moderate or vigorous?
Moderate.
Moderate? Yep. And how many times and how long for?
3 times a week, about an hour each time.
So 3 times a week and an hour, that gives you 180 minutes. So that's above the recommended 150 exercise a week. So that gives you -1 risk factor. That's really good. And what is your height?
169.
169. And your weight?
72.
72. So we worked out earlier, that gives you a BMI of 25.2, which is great, which doesn't put you over the 30 where you would get a risk factor, so that's wonderful. You're sitting in a good zone there.
Awesome.
Have you ever been told that you have high blood pressure? No. Have you ever been told that you have high cholesterol? And have you ever been told that you have high blood sugar? No. That's great. That gives you a total of -1 risk factors. Cool. That's really good. Alright. And just in this last bit, have you ever spent time in a hospital, including day administration, for any conditions in the last 12 months? No. Are you currently taking any prescribed medications? No. Are you pregnant or have you given birth within the last 12 months? Great. And do you have any bone or muscle pain, soreness that may be worse by a particular type of exercise? No. Great. And now we go down to our risk stratisfactions, and that tallies all the risks that we have so far, and with everything that you've given me, you have a -1. So that's fantastic. So that puts you as a low risk client. And it says individuals at low risk may participate in an aerobic physical activity exercise up to a vigorous or high intensity. So if we go back to this page over here, that would give you moderate for 55 to 70% of your heart rate max that you could participate in, and a moderate to somewhat hard perceived physical rate of exertion that you could participate in up to a 3 or 4. So that's great. That looks really good. Okay, we'll go on to the next.